Today is International Overdose Awareness Day. Affected families mark the day alongside local agencies trying to help. It's also a day to raise awareness about local resources that are available to those in need. Lee Noonan reports.
Zach, Johnny, Robert, Leah, Jesse, Dana, Nick, Dakota. Every year, the statistics show high rates of opioid-related deaths in Thunder Bay, but to these mothers, this day is about the children they've lost. Carolyn Carl says her whole world changed when her daughter Dana died, and now she wants to help others who are struggling with addiction.
We need to support these people. You know, we support people that have cancer. If I walked up to one of my friends and they had breast cancer, you'd hug them and say, "How are you doing? How is everything going?" But with addiction, people don't call, they don't want to talk about it. We got to end that. We got to help. We got to talk the talk.
Carl wants to see people with addictions loved and supported, and she wants to see more resources in the city. Cynthia Olson is the city's manager of community strategies. She says she wants people to feel more comfortable accessing services like supervised consumption.
Stigma can kill people if we don't start talking about things. People aren't so willing to cross the threshold of a service even, and to be out and open about their substance use.
Olson calls the local drug supply toxic, saying you can't know what's in them, and that in many cases, drug toxicity deaths are caused when other drugs are laced with fentanyl.
Our strongest message to people is never use alone. If you're going to, call a friend, download the Lifeguard app. If you don't know what's in your substances, which is what I just said is going to happen, start low, go slow if you're going to use. Use in groups and have somebody start one after the other so that you're watching out for one another. And if an overdose happens, use naloxone and call 911.
Olson encourages people to educate themselves about the services that are available, but acknowledges that the city needs more mental health, substance use, and housing supports, as well as upstream prevention.
End the stigma.
Lee Noonan, TBT News.